Hey loves, welcome back to my channel. It's your girl Janae. Today is October 6, 2020. It is currently the morning time in LA and I'm just getting up not too long ago, hence the PJs. But I'm like, these are my favorite PJs and they're pink. So I decided that I wanted to do a breast cancer awareness video. So I decided to put this little video together for my ladies and my men. So yeah, let's just get started. I'm so excited. I love informing people and just creating awareness. And breast cancer awareness, it is very important to me as a woman, as a nurse. And my godmother is a survivor of breast cancer. I wanted to kick this month off with a bang. So the focus of this video is just going to provide a little bit of information about breast cancer, and then I'll end the video, with showing you guys how to do a self breast exam, because a lot of people, and especially like a lot of younger people around my age, don't really do breast exams as often as they should, or like probably just don't even know how to do a breast exam. So instead of us just waiting until our gynecology appointment, we might as well just, learn a little bit. Let's learn from Nurse Nay. Let's get into it. Happy Breast Cancer Awareness Month. So what is breast cancer? I'm going to try to break this down really easy and in a way that everybody can remember. So cancer is a disease in which the cells in your body grows out of control and forms into these masses that are in places where it's not supposed to be. Overall can cause problems in the way that the body is supposed to be working, the way that the body works. So breast cancer is cancer within the breast area, in the armpit and breast area. There are different types of breast cancer. It all just depends on which part of the breast develops the cancer. We have the lobules, which are the glands that produce the milk. We have the ducts that carries the milk to the nipple. And we have connective tissue, which surrounds and literally like holds everything together. The most common parts of the breast that develop cancer are the ducts or the lobules. Some signs and symptoms of breast cancer are new lumps or swelling in the breast or underarm, thickening or swelling of the breast, red flaky skin, pulling inward of the nipple, pain, nipple discharge, which excludes milk. Milk is not discharge. If you have like a watery discharge, a bloody discharge, pus, any other discharge besides milk, that can be a symptom of breast cancer. Any change of the size of your breast normally, and not during your menstrual cycle, because during your menstrual cycle our boobs tend to swell, they're painful, so that excludes that as well. There are many risk factors as well as many statistics, but I'm just gonna like name a few. Some risk factors that you cannot control would be being older, like in your 50s. Sometimes us women, that's just something that we can develop as we get older. Breast cancer. Also genetics. We can't change genetics, and your reproductive history as well. Some risk for breast cancer that you can change is just like being healthy, working out, eating healthy, eating the right things. Believe it or not, drinking alcohol is a risk factor for breast cancer. So if you cut out alcohol, or if you drink alcohol a lot and you really limit it down, that is also a risk factor that you can change. As well as being overweight after menopause. As women, getting older is already a risk factor. Going through menopause is a risk factor, and then being overweight with all of that is something that we can change and prevent. Statistics show that breast cancer is the most common cancer among women in the U.S., and that black women and white women develop breast cancer around the same rate, but black women die at a higher rate than white women. So now I'm going to talk about some myths that I overhear people talking about, or I see on social media and everything like that regarding breast cancer. One of them are men can't get breast cancer. And I feel like now today a lot of people know that men can get breast cancer. It's rare, but it does happen. Because guys, just like women, men have the same anatomy of the breast. They still have the lymph nodes, they still have fatty tissue, they still have the ducts, they have nipples. Like I said, cancer is just cells and tissue that form abnormally, and that's what caused the lump. So just because women have like a bigger breast does not mean that men can't get breast cancer. They will actually have the same symptoms as women. It will be the same symptoms. Like they will still have the discharge in the nipples, can still have lumps, can still have the red flaky skin, can still have pain. Yes, men can get breast cancer. And some risk factors for men are kind of the same as the risk factors for women as well. Becoming older, family history sometimes can, play a part in that. And with men, genetic mutation will probably be at risk for developing breast cancer. Another myth is people saying like, oh, I don't have family that has breast cancer, so I won't get breast cancer. My mom didn't have breast cancer. My grandmom didn't have breast cancer, so I don't think I'm at risk of getting breast cancer. That is a myth. It actually states that most people diagnosed with breast cancer have no known family history of it, which is like a reality. Like it can happen to anybody. It can happen to a young girl. It can happen to a teenager. It can happen to an old lady in her 80s. It can happen to a lady in her 50s. It can happen to a mom who just had a baby that's breastfeeding. It can happen to any of us. Another myth that I remember hearing when I was a little girl is that wearing a bra to sleep or wearing a bra in general can cause breast cancer because of the underwire. That is a myth. It is no scientific evidence to prove that or to back that up. So you guys, that is a myth. You can wear your bras and you don't have to worry about getting breast cancer from wearing a bra. The last myth I'm going to discuss today, before I show you guys how to do a breast exam, is that getting plastic surgery, getting breast implants, a boob job, whatever you want to call it, will cause breast cancer in the long run. So that is a myth. Getting a plastic surgery procedure will not cause breast cancer in itself, but there is research out there that says women that have breast implants have a higher risk of developing a rare cancer called anaplastic large cell lymphoma. I am not really 100% sure. I didn't do like a lot of research into that cancer specifically, but I did see that women with implants are at it's a rare cancer, but they're at like a higher risk of developing that one. But getting a boob job is not going to give you breast cancer. That's what I'm saying. Okay guys, so I'm trying to keep this video short and sweet. So I'm just going to start this breast exam, a self breast exam. I'm going to talk about it first and then I'm going to demonstrate. So when do you want to do a breast exam? It is important to do a breast exam about 2 to 3 days after your period, and you want to do it as often as every month. You really shouldn't do it right before your period, because like before our period, our breasts tend to swell, they tend to hurt. So you don't really want to try to do an examination on yourself then, because you don't want to start freaking yourself out like, oh my God, like it's starting to hurt, like I don't know what this is. And then your period comes on a couple days later, you're like, oh. I would say do it like every month, a couple days after your period. So there are 2 popular ways to perform a breast exam. One is, I'm pretty sure you guys know, if you go to the gynecologist, you go to the doctor, they'll tell you to lay down, put your arm in the air, and perform your self breast exam like that. Or they'll say you can also do it in the shower. Before you start your breast exam, what you want to do is examine your breast first. Before you get the touching and the feeling and the you want to look at your breasts, okay? You want to go in front of a mirror and you want to put your hands on your hips and you just want to examine your breasts. So what you'll be looking for is any abnormalities. Like, we know how our breasts look. We see them every day. So you're looking for any changes. And it is okay, guys. Like, it is okay for one of your breasts to be larger than the other one. Like, that's normal. I'm pretty sure most of the women in the world does not have like the same size boobs. I don't even have the same size boobs. So it's like, you just want to look to see if like, okay, so if you know your norm, some things you want to look out for, like if one of your boobs are like gigantically bigger than the other one, you see like a reddened spot, you see dimples in your breast, like you see the inverted nipple, you look at your breast and it looks like an orange pill on the outside, it's burning, it's leaking, it looks deformed, it has lumps, and it just like, it's not proper, it's not your norm, it's not your normal, how your normal breasts would look like. That's what you want to look for. When you look in the mirror, you want to stand straight up, hands on your hips, and you just want to look, right? And then when you're ready, you want to lay down on your bed, lay down on a couch or wherever you want to lay. You want to lay on your back, and then you want to put your arm in the air or over your head. I usually like to put it over my head, right? So you want to lift your same arm of the breast that you're going to be examining. I'm not going to lay down because it's going to be hard to film when I'm laying down. So I'm just going to sit up, but picture me laying down in my bed. So then you want to take 2 to 3 fingertips. Then you want to gently go in circular motions around your breasts. You don't want to dig in deep like this. You want to do firm but gentle at the same time. You don't want to go too hard because it's going to hurt, it's going to be uncomfortable, and you don't want to go like just on the surface because you're not really going to feel what you're trying to feel. So that's why sometimes they'll say also do it in the shower. You can do it in the shower, put your arm up, and you can use some soap. When you use soap, when you are doing your breast exam, the water and the soap should help you feel a lump. It'll be easier to feel. That's why they tell you to do it in the shower as well. You're going to use 2 to 3 finger pads, like I said, and you're going to start from your underarm. And it's important, guys, that you don't take your hand off. It's like, it'll be easier if you don't take your hand off, because if you're like trying to feel and you're taking your hand off, you could be skipping spots where there's a lump. So you want to keep your hand on your breast. So I'll just use 3 fingers, and I'll start from the underarm. And I'll go down, make sure you get under the breast, make sure you go around the nipple area, over top. I like to go from outside in. It feels so weird because I'm like, this is not how I really do it. You know, I wouldn't have this tank top on, I wouldn't have a bra on, so it feels a little weird. Like, and then there's the silk and everything, but you guys get the point. So I'll do the right breast. Let's start with your underarm. You also want to examine your nipples. You can squeeze just to see if anything's coming out. Look for cracks, look for bleeding or any discharge like I was talking about in the beginning of this video. And just to let you know, FYI, you will feel some of the fatty tissues in your breast. Like, it's not like our breasts are just filled with air. You're going to feel stuff. So breast cancer will probably feel round, soft, and tender to the breast. And I feel like the more we, do self-breast exams every month, the more we get acquainted with our breast, it'll be easy for us to notice an abnormality. So guys, every month, do those self-breast exams, okay? So guys, I just wanted to put that out there. Like, I just wanted everybody to know a little bit about breast cancer and how to do a self-breast exam. I tried my hardest to show you guys how it actually works with my clothes on, but it felt very weird. But guys, just make sure that you're doing your breast exams every month. We want to stay healthy. We want to stay strong out here. I hope you learned a lot from this video. Please feel free to comment any questions you have down below, or feel free to message me, send me a quick DM, text me, email me, whatever you want to do. You can also drop down below how you do your breast exams. What do you feel like the best way to do it, the easiest way to do it? And if any breast cancer survivors are watching my video, I just want to say God bless. You guys kick cancer's butt. Happy Breast Cancer Awareness Month. Stay strong, stay smart, and stay beautiful. Bye, you guys.